Hello, and welcome to the learning topic of respiratory distress. This presentation was created by Cornerstone Pediatrics. The information on this site is available to you solely for general information purposes. Information on the site is not intended to diagnose or treat any illness. You should talk to your healthcare provider about how information on the site applies to your health conditions. Let's go over the following questions today. What is respiratory distress? How does it affect young children? What do I need to look out for? And how can I help my child feel better? Respiratory distress is trouble with breathing. It's also trouble getting enough oxygen in or carbon dioxide out. It can be caused by infections, injuries, airway blockages or anomalies, prematurity, or chronic illnesses. Mild respiratory distress can come with a cough and causes a small increase in the work of breathing. It may come with wheezing or no wheezing, and the child may breathe faster. There may be mild feeding difficulty. Moderate respiratory distress can also come with a cough, an increase in wheezing, and it will come with breathing faster or an increased work of breathing. This child may have feeding difficulty, and they may need oxygen, IV fluids, and inhaled medication. Severe respiratory distress can come with a cough and possible severe wheezing. Severe respiratory distress will cause a difficulty in breathing and feeding. This child may be agitated or lethargic. They will need more oxygen. They will need IV fluid and medical support. What do I need to look out for? Seek medical attention if your child is less than 3 months and has a fever of 100.4 or above. Seek medical attention for an increased work of breathing, such as retractions, head bobbing or nasal flaring, grunting at the end of breaths, or stridor. Retractions are when the skin sinks in above the neck or in between the ribs or below the rib cage when breathing in. Stridor is a whooping sound when breathing in. Seek medical attention if your child has an increase in wheezing. If they're feeding less frequently or in lower amounts, or if they have less than 4 wet diapers in 24 hours, or are generally appearing more ill. Call 911 if they look like they are tiring out from breathing. If they pause in breathing of 20 seconds, this is called apnea and it is more common in premature infants. You can stimulate the infant to breathe by tapping the bottom of their foot. Call 911 for a decrease in wheezing while breathing harder or tiring out, for grunting while exhaling, or for a blue, purple, grayish color to their lips, mouth, hands, feet, or anywhere on the body. How can I help my child feel better? Encourage normal feeding if tolerated, or smaller, more frequent feedings. Offer electrolyte solutions such as Pedialyte if not keeping breast milk or formula down. Use humidity to break up mucus by sitting outside a steamy shower or using a humidifier. Use nasal saline and a bulb syringe to relieve congestion. Although fevers can be helpful to fight the virus, fever reducers may provide comfort to miserable children and encourage fluid intake. If nebulized medications have been prescribed, give as scheduled. Thank you for learning about respiratory distress today. For medical questions, please call your provider. If you are experiencing a medical emergency, please dial 911 immediately. Do not rely on this information as a substitute for professional medical advice. Thank you for learning with Cornerstone Medical Group.